that suffering has a human face, and poverty, prosperity also has a human face. I think my organization has been in this space for a while, just like my co-panelists have said as well. And we primarily work in rural communities and work across the first 7 SDGs. And there are a lot of programs that have been designed and brought to Africa and to communities like the ones we serve. And oftentimes it's very, very difficult, despite the billions of dollars that are poured into these communities. Oftentimes, I walked into an office one day with a DC to visit a DC, and he said, a lot of times we see NGOs moving around with big vehicles, but it's very difficult to translate all the presence that they have into actual impact. And I think one of the things that I have been very privileged to see is a situation where there's an opportunity to co-create a solution with the local community. And one of the things that comes to mind is, for example, in the cancer space, we've collaborated with a pharma company through a PPP mechanism and established a cancer center in a county referral hospital. And that just takes the burden of out-of-pocket expenditure for patients who would have been traveling maybe 400 kilometers to Nairobi, and now they're receiving care in Kitui. And there are examples like that. But I think, like I said, is just seizing the opportunity to translate impact and seeing it having a human face.